how clinical pharmacists will be working in the struggle against AMR. We have our great speakers here who are all well versed by both books and practice and are contributing to the healthcare setting at various hospitals around. So let's begin with our conference. And once again, it's great pleasure to have you all here at this beautiful Saturday evening. I'm Dr. Santosh Kumar, member at Medodrix, and I'll be guiding you through this two-day conference on infectious disease pharmacy, themed Joining the Fight, Pharmacists Engaging Communities in Antimicrobial Stewardship. At first will be an introductory session with two speakers coming up to brief you about the basics of microbiology and antimicrobial essentials for pharmacy students. Our first speaker, Ms. Vaishnavi, an infectious disease intern doing her clerkship at Gleneagles Global Health City, Perumbakam, Chennai, and networking lead at Climed Research Solutions and organizational advisor at Medodrix. Ms. Vaishnavi will be sharing her knowledge on the basics of microbiology essentials. Over to you, Ms. Vaishnavi.
Thank you, Santosh. Am I audible?
Yeah, you're audible.
Yeah, good evening and a very warm welcome to everyone to the introductory session of MD-CIDP conference. Let's start discussing about the microbiology essentials. I will not be going much deep about the family and history of microorganisms because it will be boring, and I'm also a student. I will share my insights in this introductory session. We will learn about the types of microorganisms and its mechanism of resistance and the role of microbiological laboratories in choosing the right antimicrobial therapy. So, generally, what are the types of pathogenic organisms? Bacteria, virus, fungus, and the parasites. Parasites include protozoa, helminths, and ectoparasites. And then, first moving into the bacteria. So bacteria are generally classified into 4 types based on the staining. That is either gram-positive or gram-negative or acid-fast bacilli and bacilli without the cell wall. So again, the gram-positive and gram-negative are further classified into aerobic and anaerobic. That is the requirement of oxygen for their growth and not requirement of oxygen. And aerobic gram-positive are further divided into cocci and bacilli based on the shape. Cocci are spherical in shape, whereas bacilli are rod shaped. And other bacilli and other bacteria will be in comma shaped, S shaped, etc. And gram-negative aerobic are classified into fermenters and non-fermenters. In the fermenters, the major order of bacteria are enterobacterials, and non-enterobacterials include other orders including Neisseria that may be either fermenters or non-fermenters. So then differentiating the gram-positive and gram-negative bacteria structure, while coming to the gram-positive, the bacteria have a thick layer of peptidoglycan, but it lacks an outer membrane. So the drugs need to cross the thick peptidoglycan layer and binds with the pink color structure, that is the penicillin binding protein, for their activity. In the gram-negative, the peptidoglycan layer is very thin, but it has an extra outer membrane that acts as an external barrier. So this is the major difference. Next. So these are some examples of organisms in the gram-positive. In the gram-positive, we have first aerobic in that cocci. Cocci, we can easily remember that the 3 species only, enterococci, staphylococci, and streptococci. So in this, various species are present, Enterococcus faecalis, faecium, etc. So the C mentioned in the circle are the common species among these species. So Enterococcus, staphylococcus, streptococcus, all these words has coccus in this, and these are cocci. Next. Then the gram-positive aerobic bacilli. Bacilli are rod-shaped. In this, the major genus are the Corynebacterium species, Listeria species, and Nocardia species. Nocardia species has 5 different species which are commonly occurring in human beings. And then coming into the gram-positive anaerobes. Anaerobes includes Actinomyces species and Clostridium species more commonly. So here when we come to see, Actinomyces species and Nocardia species are actually a bacteria, but they act like a fungi. And moving into the Clostridium species and Listeria species, Clostridium species is also a bacilli, but it is an anaerobic bacilli. And next. Then the gram-negative aerobic enterobacterials. Enterobacterials includes all the common organisms which occur more prevalent in any hospitals. It includes Escherichia coli, Klebsiella species, Citrobacter species, Protea species, Salmonella, which causes typhoid, Shigella, and etc. Morganella species and all. Then the non-enterobacterials. It includes all other orders other than enterobacterials order. It includes Brucella, Haemophilus influenzae. For some get confused in that Haemophilus influenzae not actually causes flu. That is, caused by a influenza virus. Haemophilus influenzae causes ear infections, bronchitis, meningitis kind of infections. So flu is not actually caused by bacteria, it is caused by a virus. And others include Vibrio cholerae, which causes cholera, Neisseria meningitis that causes meningitis in human beings. Yeah, next. Then the gram-negative aerobic non-fermenters. So these are the 5 most common non-fermenters which causes nosocomial infection. That is the hospital-acquired infections in human beings in most of the hospitals. And in the Pseudomonas aeruginosa is common and Stenotrophomonas multifida. These are common organisms among non-fermenters. Apart from that, Acinetobacter species and Burkholderia species are also common. So then the anaerobes. Mostly we will be seeing the physician will be giving empirical therapy as metronidazole. When we ask them why, they will be saying that it is for gram-negative anaerobic coverage. So we will see what is the actual gram-negative anaerobes organisms. There is the Bacteroides species and Prevotella species. So these are the species for which the metronidazole is actually used. So then the acid-fast bacilli. The organism which can be visualized in the gram staining will be visualized in the acid staining. So in that, acid-fast bacilli are classified. Mycobacterium species are all coming under the acid-fast bacilli. This causes tuberculosis. And the bacilli without cell wall includes Mycoplasma species. Next. Then the mechanism of resistance. The gram-negative bacteria, how it develops resistance. It produces an enzyme that is called as the beta-lactamases. The beta-lactamases are classified based on the Ambler classification. Ambler class includes A, B, C, and D. Within class A, there are 3 subclasses. The subclasses which are mentioned here, penicillinases, cephalosporinases, ESBLs, etc., are phenotypes. Whereas the examples given, M1, SHIV1, CTXM, KPC, IMVM, NDM are the genotypes of the organism. So first we'll be identifying what is the phenotype, then we'll be moving on to the identification of the genotype. So these are the phenotypes and genotypes. Next. So non-enzymatic mechanism of resistance. So we already saw the mechanism of action. So for the mechanism, the antibiotic needs to enter the bacterial wall and then it needs to bind with the protein. That is a pink color structure we already seen. There is a penicillin binding protein. So how the resistance occurs, we can easily say that if the antibiotic can't enter into the bacterial cell, that is the first thing. There is a decreased permeability. Then if the antibiotic can enter this bacteria, but it can't bind with more affinity with the penicillin binding proteins, that also causes a resistance. But if it enters the bacteria, but the bacteria throws the drug out, that also causes the resistance. And then the biofilm formation. This instance, the bacteria adheres to the surface and it forms a sticky material, that is the biofilm. When the biofilm matures, it develops a resistance and doesn't allow any agents to enter inside the bacteria. And the target overproduction, mimicking or bypass, there is the overproduction of any enzymes that mimics the target, so that just confusing the agent, antimicrobial agent. So every examples are given here. Then the gram-positive resistance determinants. So for the gram-positive, these are the major genes that causes the resistance. VAN-A, VAN-B, MEC-A or MEC-C. So in the name itself, we can identify VAN-A, VAN-B causes resistance to vancomycin antibiotics. VAN-A causes additional resistance to teicoplanin, dalbavancin and jalavancin. These are the glycopeptide antibiotics. So the alternative antibiotics that can be given is oritavancin, linezolid and raptomycin. In the case of vancomycin resistance, we can give oritavancin and linezolid. And then VAN-B resistance, in sense there is resistance only to vancomycin, so teicoplanin, dalbavancin will even work. So that is the alternative antibiotic. MEC-A or MEC-C, that is most commonly found in the Staphylococcus aureus, that is the methicillin resistant Staphylococcus aureus. Staphylococcus aureus commonly the commonly used drug is the penicillin class of antibiotics, but they develop resistance to methicillin. So these are called as methicillin resistant Staphylococcus aureus. Penicillins, carbapenems, all cephalosporins except ceftaroline and ceftabiprole is resistant. Here we can see that carbapenem is a higher class, but even that is resistant. But the higher generation, that is the 5th generation cephalosporin like ceftaroline and ceftabiprole, works well against it. So ceftaroline not only works against MRSA, it also works against VRSA, that is the vancomycin resistant Staphylococcus aureus. Next. So gram-negative resistance determinants. We already saw AMC, CTXM. These are the genotypes in the Ambler classification table itself. So it is resistance. So here we can see what are the classes. In the Ambler classification, class A, C, and D are the serine beta-lactamases, whereas class B is the metallo-beta-lactamases. So this is the difference. And here in the resistance to the third column, we can clearly see that everything Astrionum are resistant, but only in the last column in PBM and NDM, the Astrionum is sensitive. So for the additional coverage, to cover the class B of the AMLA classification only, Astrionum is given as a combination with ceftazidime, avibactam, and Astrionum. Here we can see in the alternative antibiotics column. Next. So this is general morphology, structure of the bacteria, cocci, spherical, bacillar, rod-shaped, spiral, etc. and gram-positive, gram-negative, both based on the shape of the bacteria specified. Next. So next, coming on to identification susceptibility testing. How we can identify a bacteria? First, we need to use the microscopy. Microscopy includes gram staining, acid fast staining. Gram staining, we already saw gram positive, gram negative bacteria. Acid fast staining, acid fast bacilli. Spore staining, in sense we can differentiate the bacterial endospores, and the negative staining it used to provide a contrast and motility test to identify the motility of the bacteria. And with this, we can identify only it is a gram positive or gram negative. Further culturing is necessary. For the culturing, we'll be using these different types of media, which is mentioned below. So first, when the sample is collected, we'll be using that and putting it on a blood agar and in the McConkey agar and in the chocolate agar. Blood agar is used to identify the gram positive organisms. It will show beta hemolysis, alpha hemolysis, or gamma hemolysis. Beta is complete hemolysis, alpha is partial, and gamma is no hemolysis. If it is a beta hemolysis, we can identify it as either Listeria species or Clostridium species. In alpha hemolysis, it might be Streptococcus species. Gamma hemolysis, it might be Staphylococcus species. McConkey agar easily identifies the gram-negative bacteria. It differentiates the lactose fermenter and non-lactose fermenter. So non-lactose fermenter, we saw that is the Stenotrophomonas maltophilia, which is the non-fermenter, and then the Pseudomonas aeruginosa, etc. species. So moving on to the next. This is the chocolate agar in which the Haemophilus species and Neisseria species grows well. This is the difference which is seen in them. And then after identifying the genus, we need to identify what species and what the subspecies. So for that, we will be performing the biochemical test. We will be doing either catalase, oxidase, indole, etc. test, and we will be seeing which is showing positive for which test. With that, we will be classifying which genus, which species, and which subspecies even in sometimes. So especially for enterobacterials, we will be using IMVIC reactions. That is IMVC, which is the indole test, methyl red test, Vox-Pasteur test, and citrate test. So based on the positive, negative, in sense it comes in sense there is E. coli. So based on this, we will be classifying it. Next. So then another method of detection is the automated detection. There is the BACTEC and VITEC method. BACTEC uses fluorescent principle. Based on the amount of carbon dioxide present, the amount of fluorescence increases. That's get detected by the BACTEC machine. And then the VITEC is fully automated. That identifies the bacteria and also gives the susceptibility report. And then the antimicrobial susceptibility testing can be done by several other methods. There is the disk diffusion method, broad dilution method, gradient diffusion method, VITEC, and rapid phenotypic antibiogram. The disk diffusion method is given as an example in the figure in the left side. So this the disk of various antibiotics will be placed in this, and based on the diameter, based on the zone, we will be considering whether there is a growth of zone of inhibition. So based on that, we will be giving whether the drug is sensitive or resistant. In the gradient diffusion method, but this diffusion method doesn't give MIC values, but gradient diffusion method we will be using a gradient antibiotic concentrations so that we can give the MIC values. There is a minimum inhibitory concentrations. So then these will identify the phenotype of the organism. Then we need to identify the genotype of the organism. That is we saw IMPVM, NDM, those and all. So for that we will be performing CARBA assay and then the molecular antibiogram. Next. Then antimicrobial agents that should be considered for testing, that is by the CLSI guidelines, the drugs which are approved by the FDA for clinical use, and drugs which are considered with the institutional guidelines, which are in the hospital formulary, and based on the patient factors and based on the organism specific characters. If we suspect as gram positive organisms in the microscopic gram staining, we need to consider vancomycin, linezolid kind of antibiotics instead of considering beta-lactam antibiotics, and vice versa for the gram negative. Next. This is the ideal AST antimicrobial susceptibility report showing organism. So here it is showing urine culture showing Klebsiella pneumoniae, which is a probable AMC. That is also mentioned here. So probable AMC, that is the phenotype, and we can see the sensitivity pattern also. In this, as it is a gram negative, we can see all the beta lactams are all the beta lactams whose sensitivity is reported here, and MIC values are given next to this. And this is the CARBA assay report showing genotypes of carbaphenamases enzymes. So here in this, that is given that NDM and OXA48 is detected. Others are not detected. This is the ideal report. Next. So next, moving into the virus. Virus can be classified based on the nucleic acid present, either DNA or RNA, double-stranded or single-stranded, positive or negative-stranded RNA, etc. And icosahedral or helical, naked or enveloped, and then icosahedral instance. In this, the below in the image we can see each circle is one capsomer. Based on the number of capsomers, also we can classify this. And this next structure is the helical form. In the helical, we can measure the diameter. Based on the diameter of the helical capsid virus, also we can classify this. Generally, DNA viruses are double-stranded and are icosahedral and are naked and replicate in the nucleus, whereas RNA viruses are just exactly opposite. But there is some exceptions in these cases also. So then, positive and RNA viruses will be half of them will be positive stranded and half of them will be negative stranded. DNA will be having double stranded, which will one will be positive and one will be negative. These are some images of the structures of the viruses which commonly infect human beings. So here we can, what is the similarities here? We can see in all the viruses in sense, all have spikes and all is having protein structure in the outer spike layer. So what is the differences that we can see here is, next slide please. Here we can see what the differences is that first image herpes virus and second image rhinovirus. Here we can see that there is an envelope which other viruses are not having. This envelope is a unique feature. Others are naked, this is enveloped. And then this is having a double-stranded DNA. We can clearly notice this is having double-stranded DNA. Adenovirus is also having double-stranded DNA. While dengue virus is having a single-stranded RNA. HPV is having a double-stranded DNA. We can clearly identify this. And then in the herpes virus, we have mentioned that there is a capsomer. That is, it is having a icosahedral symmetry. So these are some differentiating features among these different viruses. Next. So then this is just to clarify that the size of the virus is just so small compared to the bacteria. Even if we sum up all the DNA viruses and the size is compared in sense, it is very small when compared to an individual Escherichia coli species. So only for that. And then the RNA viruses can directly produce proteins, whereas negative RNA will be first transcribed to positive and then produce proteins. DNA, in case of DNA viruses in sense, it first transcribed into mRNA. The negative strand is only considered for transcription, whereas positive strand will be ignored for transcription. And after the mRNA production, it will be translated into proteins and enzymes. Next. So how we can identify the virus? Through electron microscopy and then the serology test. The most common test used is ELISA and ELFA. That is the enzyme-linked immunosorbent assay for scrub typhus IgG positive, scrub typhus IgG negative. They will be reporting like that. And ELFA, that is the enzyme-linked fluorescent assay. So dengue IgG positive, like that they will be giving the report. So then molecular techniques, as we know, PCR and reverse transcriptase PCR and immunofluorescence method. Based on the fluorescence level, it detects the antigens and viral infectivity assays. Example is viral plaque assays, which detects how much ability the virus has to cause infection, how severe it can cause infection. That is the thing. And then the mechanism of resistance. The same mechanism will usually occurs. There is a genetic mutation. Genetic mutation occurs in almost all organisms. Based on the mutations only, the resistance develop in all organisms. And then the altered drug targets. The drug needs to bind with a specific target, but the organisms gets to change the target. Some changes in their target structure, so that the drug can't bind there. And then the biochemical changes. Biochemical changes, for example, you can see herpes simplex virus can become resistant to acyclovir if there are changes in the viral thymidine kinase that prevent the drug's activation. The drugs become inactivated. So then the immune evasion. If the if the organism just develop resistance, then it evade even the immune system by altering the surface proteins. So this is the another mechanism. Next. So then moving into the fungus. So in the fungus, based on the site the infection occurs, we can classify the type of infections and the organism which is responsible for it. If the fungus is causing superficial infection, that is dependent on Pityriasis versicolor and Naupnia nigra. Then if it is causing in the cutaneous layer, that is beneath the superficial layer, then it might be dermatophytosis and candidiasis. Dermatophytosis is the infections of the skin, hair, and nail, etc. So these are caused by the Tinea species and candidiasis of the skin. This is more common, and all the Candida species will be included in this. And the subcutaneous, this is furthermore deeper than the cutaneous layer. So the two infections that occurs is the sporotrichosis and chromoblastomycosis. And then the systemic side, there is the infection in the blood and internal organs. So in the systemic side, the infections caused is the first common infections is the candidiasis, then aspergillosis, then mucormycosis, then it is the coccidiomycosis, histoplasmosis, blastomycosis, and fusariosis, etc. So these are the four common species that causes infections in the systemic side. Next. So this is the yeast and mold. Fungi can either be yeast or mold. So yeasts are unicellular form of fungi, whereas molds are multicellular colonies of hyphae. Hyphae. These molds produces spores, which are the reproductive bodies of the molds. Yeast cells are either spherical or ellipsoidal that reproduce by budding. Fungi reproduce either sexually or asexually. Yes, next. Identification susceptibility testing. So MALDI-TOF, there is the matrix assisted laser desorption or ionization time of flight. So the organism will be first led to undergo the ionization phase, then it will be undergoing the time of flight phase. The time taken for the time of flight phase will be considered, and based on that, the susceptibility will be given. And the culturing and antimicrobial susceptibility testing will be similar to the bacteria, but the drugs which are included in this are the antifungal drugs. There is this fluconazole, azole, all the azole classes like fluconazole, voriconazole, itraconazole, isavuconazole, posaconazole, and other drugs like amphotericin B, echinocandins also. So then, the mechanism of resistance, how it develops resistance. So this is also the almost same mechanism. Alterations in the drug target, enhanced drug efflux. Enhanced drug efflux is the drug gets thrown out by the organism. Then the alteration in the sterol biosynthesis. Sterol is the major component of the fungus. When the sterol biosynthesis is altered, then the drug cannot act and act efficiently. This is the resistance of Aspergillus fumigatus to the amphotericin B. Then the parasites, that includes protozoa. There is intestinal and extraintestinal protozoa, which causes amoebiasis, giardiasis, and next. These are the examples of some helminths, and more details we can see with the websites, CDC websites. Next. And ectoparasites generally live on the surface of the host cells for their living, and they live either in the head or in the whole body. That is called as a head lice or body lice. So then Sarcoptes scabi, which causes scabies. And next is how we can identify based on skin scraping. This shows eggs and mites in the, because it causes infections in the superficial layer. We can just do skin. If it is an intestinal protozoa, we can easily do stool antigen, stool PCR, stool enzyme immunoassay, stool immunofluorescence testing and all. So then for malaria, we'll be doing microscopic and rapid antigen detection tests. Next. So facts and take home message: TB and typhoid is caused by bacteria, and living near cattle farms also may increase the risk of zoonotic infections. Not all azoles are antifungals. The exception is the metronidazole. Dengue and chikungunya are viral infections that don't need antibiotic therapy. Asymptomatic bacteria is not necessary to be treated unless it occurs in special populations. Local resistance pattern must be considered while giving an antibiotic therapy instead of considering the global resistance trends. And antibiotic desensitization must be done to overcome the allergic reactions that occur in patients. Then antibiotics can reduce the good bacteria population in our body. So we need to take some probiotic. So the food that contains probiotic includes curd, etc. And aztreonam is sensitive against class B. So for that purpose only, we are using that in the combination therapy. Thank you.
Thank you, Ms. Vaishnavi. That was some great talk there, and you gave us a beautiful start in this conference.